Hi there, it's Suzanne, the podiatrist here from Active Health Solution. I just wanted to introduce myself before your first consultation with myself, and also to give you a little bit more information about what to expect at your first visit. Usually what happens during the initial consultation is we will spend the first 10 or 15 minutes just getting some information from you regarding any relevant medical history, any medication you're taking, and details around the area of maybe of concern that you're having, or pain or injury. Following this, then what we will usually do is an assessment, and the assessment can come in different parts. Usually, first of all, we will have a look at you sitting or lying on the treatment couch, and I will carry out a few assessments. Following this, I may get you to do a few tests, examinations with you standing on the ground, and performing different tests as I kind of demonstrate. As well, what we sometimes do is have a look at you walking in our clinic as well, which gives me a good idea maybe of your walking gait and any problems that may be occurring there as well. In the instance of runners, we have a treadmill upstairs in our gym, and in some cases what I may do is bring you upstairs and have a look at you running just on the treadmill, which may give me a good indication as well about any abnormalities in your running gait that may be contributing to any of the problems or pain that you're having. Following this, then what I tend to do is have a chat with you just to let you know about some of the findings that I may have found from the assessment. At this point, we may need to refer on to the GP for bloods or request some imaging as well. So I'll have a chat with you through all that as well, depending on what we find. And afterwards, really what we try to do is put together a treatment plan. So things that we can do to try and get you better, to make you feel more comfortable, pain-free, or in some cases it may just have to make alterations to your foot orthotics or different running or footwear types. So I'll have a talk with you through all of that afterwards as well, and also gives you an opportunity to ask me any questions. Sometimes there can be a lot of information to take in your initial consultation, so I always encourage clients to talk with me, and if there's anything I've confused them about, I always like to make sure that clients leave after their first consultation feeling confident in, I suppose, their diagnosis or in how we're going to pursue investigations further, and more importantly their treatment plan. So I look forward to seeing you at your podiatry appointment. If there's any questions or queries before then, please feel free to get in touch with the clinic. One final note, I suppose, when coming for your initial assessment, it can be really handy for me if you can have a list of relevant medication and any footwear, shoes in particular that you would like me to have a look at. Please feel free to bring them with you, and any orthotics or insoles that you wear inside your shoes, I would really encourage you to bring those as well. Wearing a pair of shorts or gym leggings can be really beneficial as well, because it can let me have a good look at your lower limb during the assessment, which can be really beneficial as well. Look forward to seeing you soon. Thank you.